Wound bed preparation has really altered the way we treat wounds in a very fundamental way. Since this concept came along, we finally have a better understanding of the pathogenesis and treatment of chronic wounds.
Wound bed preparation means to me a model or a way of systematically looking at chronic wound healing. And I think it's really important because it signals to us a way to shift our thinking from the old way of looking at acute wound healing, which really has frustrated us clinicians who have been trying to heal these chronic wounds.
The main challenge is that we all must understand that the chronic wound is not just simply an acute wound that doesn't heal, but a total different pathologic entity. And if we have understood and accepted that, then of course wound bed preparation will be introduced very easily.
The time concept allows us to integrate the evidence base into clinical practice. T is for tissue we want to remove. I is for infection or inflammation that needs to be assessed and corrected. M is for moisture balance. We don't want too much or too little. And E is for an epidermal edge that we're encouraging to grow along the margins of the wound so that we can affect healing.
I think wound bed preparation undoubtedly makes sense. I think there is a challenge to educate people, there's a challenge to implement wound bed preparation in clinical practice, but the longer term challenge is to develop research experiments that actually provide us with a means by which we can measure the completeness, the efficiency or effectiveness by which we actually achieve wound bed preparation in a population or even in individual patients.
I see the work of the advisory board and the development of the timetable as significant in its contribution to educating specialist and non-specialist nurses in wound care, because it offers an integrated approach. And time, the acronym TIME, is time to prepare the wound, time to move on in our thinking in wound management.
Yes, I think that the timetable that the advisory board has developed will be an extremely useful resource for the clinician, primarily because it identifies the clinical problems that are the key problems that occur with wounds, and it links that to the pathophysiological process that's underpinning those problems. And then it identifies the therapeutic options that you have, and by doing that it'll enable the grassroots clinician to really understand how to treat the particular problem that they find in a wound.
I believe the principles and concepts of wound bed preparation will stimulate new ideas on the molecular pathophysiology of chronic wounds, and will also provide the framework in which new clinical studies will be designed.
The TIME acronym has a special significance in bringing together practitioners from different specialties. Either EMWA or EPOEP will be an excellent vehicle to present every year the amount of data produced by this new concept.